To the From Guilt to Good podcast, where we discuss all things caregivers wish people would talk about, but don't, won't, or can't. Hi, my name is Jeanette Yates, and I'm a lifelong caregiver for my mom and founder of The Self Caregiver, where I help caregivers feel good, not guilty. And today I am so excited to welcome Matthew Tyler. He is a dual board certified in internal medicine and hospice and palliative care. He has over a decade of clinical experience caring for patients and their families in hospital, clinic, and home-based settings. Matthew is a passionate believer in the power of social media, which I can't wait to talk about in a minute. But he uses social media to educate people on public health, especially hospice and palliative care. His teaching focuses on palliative care, facts, and myths so that patients and families can advocate for the support they deserve. Matthew's videos have garnered millions of views across a variety of social media platforms, including Instagram, Facebook, YouTube, and where I first met you on TikTok. Welcome, Matthew. Thank you so much for coming and joining me today.
Hey, thank you so much for having me.
So, as listeners of this podcast know, I really love just interviewing caregivers, having them share their story. We all, bond over, our differences and also the things that we have in common, usually guilt or exhaustion in some way. But another thing I love to do is have people on this podcast that I think that helped me personally, and also I think would benefit the other caregivers listening. And you are one such person. I am honored to have you here today. You may not know this, but your TikTok feed, your post really gave me the courage to explore hospice and palliative care more earnestly. I don't want to say seriously, but earnestly for my mother. And we can talk a little bit about that specifically because I think there's a lot of people in the same boat that I was. And then I remember still being so confused, despite your great work and despite all of my Googling on the internet, but still being unsure if it really was time. It really was time. And so I reached out to you. You do some one-on-one coaching. And in one crazy conversation, which I don't know if you remember, but I had to chase my dog down the street while holding my laptop because she got out. But anyway,
Oh, I
in
remember.
in one crazy conversation, you helped me a lot. So I just want to thank you for that from the outset. And then we're going to dive right in. And the first question I have for you is, what got you into, so you're board certified in internal medicine. Did you start that? And then how did you get into hospice and palliative?
Yeah. So I did not go to medical school or even residency with any intentions on doing hospice and palliative medicine. It was kind of a long and winding road to begin with. But by the time I got to residency, I thought I was going to do GI because I thought, hey, like procedures are cool. And, GI gets to do procedures. But this was early into my intern year as an internal medicine resident. I was already noticing the culture of healthcare delivery, just something felt missing. And I noticed this particular in my work at the VA, working with veterans, and how you would talk to patients that was mostly not talking to, but kind of talking at, right? Like, you need to take this pill. You need to follow up with this specialist, and it would, very instructive. And the patients for their role would say, sure, doc, whatever you say, doc, and kind of just go along with it without really questioning things. But there would be these little moments every now and then when the patient would say something, indicate some fear, some worry, and we kind of dive into that and start to build a better sense of what quality of life meant to that person, what they're really hoping for. Sometimes that conversation would lead us to realize that this medical treatment plan really didn't make any sense. This chemotherapy that we were setting this person up for wasn't really going to help them accomplish anything that they were looking to accomplish with their time. And it was more just an observation at that time that crystallized when, by pure happenstance, I had an elective rotation in palliative medicine. I think it was like my fourth or fifth choice or something. I got saddled with it because I was bitter that I didn't get a GI rotation. But in this rotation, I got to see the actual framework that a palliative medicine doctor took to their conversations with patients, where they really flipped the whole script around rather than saying, you need to do this, you need to take this pill, and sort of talking at patients. They flipped it around and said, hey, like, what can we do for you? Essentially, what's important to you? What does good care look like to you? And how can we help deliver on that? And it was completely mind blowing, and it was for all that we gripe about sort of like the customer service aspects of healthcare. This
Right.
was like the customer service done right, like
Right. Right.
the true care partnership that comes with a healthy physician patient relationship. And I was just obsessed. I was obsessed with it from the moment that I saw it and said, oh, this is what I want to do for the rest of my life.
Yeah.
And that was like halfway through intern year. And I just set my sights on doing palliative medicine from there on out. So I went straight from residency into the hospice and palliative medicine fellowship. And from there, jumped into working as a full-time palliative care consultant at the hospital.
Well, and I, for one, and then millions of people that follow you all over the social medias, we're very thankful. Just, I think most people listening to this podcast, we're caregivers, and we have heard hospice and palliative care thrown around quite a bit, but none of us really, until we were faced with it, really understand it. So Reader's Digest version, they're often lumped together, hospice and palliative care. I drive past a hospice place every day, and it's called blank hospice and palliative care. So it's lumped together, but they're similar, perhaps overlap in some ways, but they're different. Can you just do a brief explainer of what is palliative care? What is hospice care?
Absolutely. Thank you for asking. So, palliative care is a medical specialty that focuses on your quality of life. So, we are specialists that take a team based approach to manage any of the symptoms and stressors related to a serious illness. So, that may include pain management, nausea management, kind of those physical stressors of your illness. But it may also include anticipatory guidance. You're talking about what to expect as the illness kind of follows its natural course,
Mhm.
talking through some difficult choices that you may be faced with about whether or not the clinical trial makes sense or if a feeding tube makes sense. And also recognizing the emotional stresses, spiritual, psychosocial, all those other things that kind of feed into what's on your mind, what's stressing you out, what's making this hard, and addressing those, not even necessarily fixing them, but just addressing them, giving them space to breathe. So that's palliative care, just focusing
Mhm.
on all the aspects of giving you the best quality of life possible. Hospice, you can think of as a specialty within palliative care that is specifically end of life care. And in end of life care, we mean that to be a life expectancy that would be 6 months or less if the illness ran its expected and natural course, which obviously comes with caveats. But hospice care is a kind of a comfort focused care in those last 6 months of.
I do want to talk about that particular thing. So just to kind of sum up, the like palliative care is focused on comfort. So is hospice care, but hospice will focus more, is towards that end of life stage. Um, for my mom, and like you said, there are caveats. So I'm gonna tell everybody one, which is my mom's disease was not going to get any better, but there was no like there was no time associated with how long she would stay alive, but she also was not going to get better, and she was already starting to deteriorate. And so there were some criteria that she met as far as what she was able to do for herself, how much she was eating, and that kind of stuff, that allowed her to be on hospice for longer than 6 months because of the way things were happening. And one thing I did not know or understand fully was when we did palliative care first, because, and this is one of the things, because you talked about like the focus on comfort, and maybe you don't do some treatments, let's say in palliative care, you don't do some treatments because the quality of life might deteriorate past where someone wants them. So that might be something that you discuss. But one of the things that was an issue for me and my mom when we were talking about whether or not she was ready for palliative care, um, was, yeah, she really wanted to be comfortable, but also she had this expectation that she was going to improve in some ways that she just was not. And so there was this period of time where her body was ready for palliative care, and even part of her was ready for palliative care because she was so tired of being uncomfortable, but she just couldn't say, you know, that she was ready. How would you if you're talking to a family, so both people, me and my mother, let's say, how would you talk to them or counsel them or advise them? We'll use the word advise, not counsel. Advise them when trying to make that decision.
Yeah, yeah. So you're actually touching on one of the more common misconceptions, even in healthcare, about
Right.
palliative care and who should be connected to palliative care, and why I got onto social media to talk about palliative care in the first place, which is
Hmm.
this key key component that you can get palliative care alongside all your other treatments. There's palliative care is just more support. There is
Hmm.
no caveat to that. You don't have to stop any treatment or be looking at comfort exclusive care when you're seeking palliative care.
Right.
And that's one of the defining distinctions between palliative care and hospice is that
Hmm.
when you're entering hospice care, it's sort of the understanding that we're letting this illness more or less run its natural course with a comfort exclusive focus. Whereas palliative care is more comfort inclusive, that getting connected to palliative care just says that comfort's important to me, quality of life is important to me, but also there are some aspects to my actual disease focused care that I still want to continue,
Right.
whether that's chemotherapy or your clinical trials or whatever that
Hmm.
is. You can get all that alongside palliative care. And even in healthcare, that one of the most irritating phrases that I hear is this person's not ready for palliative care.
Right.
And it's like, well, what do you mean by that?
Everybody can have
They
palliative
don't
care.
have they don't have a serious illness, like they don't care about quality of life. If they don't have a serious illness, then I would agree they're not ready for palliative care. But if you have some diagnosis that is progressive and chronic and likely going to be the thing that ultimately is what you die from, then
Hmm.
it is worth that initial palliative care evaluation just to see
Yeah.
where are you at, how can we make things just a little bit easier for you right now, and what are some things that we can start working on for the future. And so in your mom's case, a big piece of that is coping. And
Right.
I think one of the more common barriers on the patient side, on the family side, is maybe a difficulty acknowledging that you have a serious illness in the first
Hmm.
place. Because if you
Hmm.
don't have that common ground to just acknowledge that you've got something going on with your health that's, somewhat of a serious deal, then it may not make sense inherently to meet with palliative care. But even then, it's sort of just talking about how the illness is impacting your life and what we could be doing better for you. And ideally over time with palliative care, developing those coping skills to talk
Hmm.
about the harder stuff, the more future focused stuff, and start to just give you the support and structure you need to start making those plans as things continue to change.
Well, and that's why I asked you that question because because I found that out. I found out that palliative care could actually help my mother even as she was still receiving her treatments that we already realized weren't working, but she just wasn't ready to give them up because she'd spent 40 years, doing all the things that her doctors offered to try
Hmm.
to regain, the strength at any given time, so she just wasn't that was the only thing that she had ever done was, is there another medicine I can take, a treatment I can do, blah, blah, blah. Like, I will do it. And so we were able to say, okay, well, you also are stuck in your bed, you're bed bound, you're very uncomfortable all the time. What if we added this element of comfort care to what you're already doing? And she was very open to that. And it actually helped her, receive that extra support. And, palliative care doesn't do as much for families as hospice care does. In my experience, you can talk a little bit more about that. But like, I still had enough support from the palliative care team to be able to ask questions, and they would meet with both of us and have these conversations. It was really helpful during that time when she just wasn't quite ready to give up those treatments. And then eventually she was because she realized one of the things that was making her uncomfortable was the treatment. And they weren't doing any good.
Yeah.
And she's like, the only thing I'm getting out of this
Yeah.
is a headache. And so it's not even doing anything. But will you talk a little bit about the support for families in palliative care versus hospice care? Because I think that's something that as caregivers, we don't even think about. We're like, it's all about our loved one. But I know that when we did bring on hospice care, the amount of support I received from the hospice team was so helpful to me in those last months.
Yeah. Yeah. Well, I think we're touching on sort of the delivery of both palliative and hospice care services
Mhm.
and what that really looks like. As far as caregivers and families go, palliative care and hospice both share this philosophy of kind of the family unit being an
Mhm.
important part of patients' care. We share a common philosophy of it just being a team sport in general. So your palliative team, your hospice team typically will include multiple types of disciplines, meaning docs, nurses, social workers, chaplains, that sort of thing. And in in both fields, one of the more helpful aspects of palliative or hospice caregivers is just the acknowledgement that there is a caregiver or a care partner or a spouse or a child. Just acknowledging that you're kind of part of this person's support and an important part of their support, and that you need support too. So often our conversations in palliative care will kind of be those dual conversations with patient and family member or partner, to give you that anticipatory guidance. How does this illness play out? What are the milestones to tell you that things are changing? What
Mhm.
decisions may come up as we hit those milestones, to help you prepare for that to the degree that you want to prepare for that, while
Mhm.
managing symptoms and those other stressors that we talked about. Hospice care is just sort of all those things dialed up, as
Right.
you were getting at, that once you enter hospice care, it is really truly wraparound services
Mm.
meant to support you in your home, to allow you to age in place, die in place as comfortably as possible. So whereas palliative care, maybe you're getting check-ins every few weeks, month or so, a couple of months or so, as you would any other specialist, kind of a similar cadence.
Mhm.
Hospice care, you may be getting multiple visits a week by multiple different disciplines of nurse, social worker, nurse assistant, chaplain. It's just all the stuff, but dialed it more intensely, more
Mhm.
frequently. You get equipment delivered to your home, like a bed with the head that goes up, or an
Yeah.
oxygen, a lift, incontinence supplies, briefs, all those things, plus the medications you would need to manage any symptoms that would come up in an emergency. Hospice has that 24/7 nursing hotline that if mom changes at 2 in the morning on a Sunday,
Mhm.
you don't know what to do. You have a nurse on the phone you can call that can send someone to your home to troubleshoot symptom control.
Mhm.
It's all that stuff, wraparound services and hospice
Yeah.
care. Does that
Um,
sound right from your
yeah, and
experience?
what I was gonna say, just to make this point as well, because while, many times a family member is able to be at home, and hospice does help that happen, like you just mentioned, providing the bed, the supplies, things like that, the check-ins and things like that. In my mom's case, she was in a nursing home already, needed to stay there for health, her health reasons. There was not the opportunity to bring her home, but hospice worked with the place where she was and with me. So I received a phone call every day, probably from someone on the team, and they were working with the employees of the place where she lived. So it was truly a wraparound. I felt like even the people that were caring for my mom where she was were like, "Oh, we love this because there's even more support," So it was a team effort. And
Yeah.
I have said multiple times to anyone who will listen, and I'll say it again right now. I believe that the hospice care was pivotal in helping me walk my mom to the end of her life. And I don't know if I would have had the emotional or physical ability to do it, because I was already, kind of exhausted, and, it was a stressful situation. But to have literally like someone there explaining everything to me, and probably multiple times, because I would be like, "Can you say that again? Can you please say that again?" And I won't go too much into specifics today, but I just know that for me, whether, I've had family members and friends who've had hospice come into their home. I've had, my experience with the nursing home. It was every single time I have felt like it's only been helpful. It hasn't been unhelpful or even, or harmful. And so, and I love one of the things too that really helped me. And for somebody that is like, is it, listening to this and they're like, maybe it's time to call in and get, you mentioned a consultation. You can call and get a
Mhm.
consultation for palliative care or hospice. And if your loved one is not ready, they're not going, that you will know, like, it's a consultation. It doesn't, you're not signing away anything or giving up or anything like that. You're, just having someone come take a look. So that was really helpful to me. And then another thing, that because of my mom's condition, they were like, "Well, there's not a timeline, but if your mom does start to improve, you don't have to stay on hospice." Like, that was
Mhm.
another thing that was really helpful for me. And I know in many cases there is that 6 months trajectory. There are no more, like, there's things are winding down. My mom's case, was similar but different in the sense that she wasn't getting treatments anymore, but her treatments were not chemotherapy type treatments. And so there wasn't this timeline. But also, my mom wanted to be able to say, like, what if I change my mind? It's like, well,
Mhm.
you can change your mind. It's okay. And that gave her a lot of peace. And I know for some people who are making the decision without the benefit of their loved ones' input, a lot of times, I think it's important to know that the family has, the right to change their mind, the right to ask more questions, the right to go back to palliative care. And so that was something that I did not know until I was in it, but was very thankful for it.
Yeah, yeah. And I appreciate you sharing all that because it really does model what a good hospice team is going
Mhm.
to feel like. Because I'm sure you've seen as well as I, you get on social media talking about hospice and palliative care, and everyone's got a story to share. And some
Right.
of them are not very flattering stories
Mhm.
to the hospice and palliative experience. And, it's the internet, so people can say anything, but I typically take the stance of believing what people say.
Right. Of course.
And we know that there are bad actors out there, especially in the hospice field. It's a big deal. But as you said, a good hospice is not going to pressure you into joining hospice, and you can do that consultation. I usually call it an info visit just to get a
Mm.
sense of, does this person even qualify for hospice? What does that support look like, and all that stuff. And it's going to be hopefully empowering and just informative if you're working with a good hospice. And if it doesn't feel like that, that's probably a good sign to call a different hospice and meet with a
Right.
different one. And it's so nice to do this when things are fairly stable. So that way you don't feel pressured to sign on with a group that you
Mhm.
don't have a good vibe about. It gives you time to explore the different agencies in your area and find that good fit before there's a crisis and you don't have a lot of time to shop around because you need help right now, even if it's not great help.
Right.
And the other thing you say, which I do think is important to emphasize, is that we kind of use that term home very broadly, and home can
Mhm.
refer to the literal house you live in, as well as a condo, an apartment, but also a nursing facility, assisted living, independent living community. Any of
Mhm.
those things, kind of Medicare would call it your home, where hospice
Right.
services can be provided.
Okay, so I want to combine my next two questions kind of because we've gone deeper into the thing the questions 1 and 2 essentially, but I want to focus on your social media work and to add the second part on social media, how to train your doctor. You focus a lot on busting myths or at least clarifying a lot of things about hospice and palliative care. Can you just give us a little bit of like behind the scenes, like why did you start doing that? Like what did you think, oh, I want to be a TikTok creator?
Yeah, it was more of just seeing and hearing the same things over and over again in my clinical work. So I touched on one of those earlier, which was this common refrain of, this patient isn't ready for palliative care.
Mhm.
And such a nonsense phrase, unless this person literally has like no serious illness diagnosis, in which case, sure, I would agree with you. But often I would, in the hallways, like walk past a doc and like, oh yeah, I'm taking care of this person. They have metastatic cancer, and they're here for a pain crisis, but I'm not sure if they're ready for palliative care. And I'm thinking, what? Like, so they don't have metastatic cancer, or they don't have severe pain, or they don't want to talk about their options and explore what's on their mind. Like, which is usually never, sometimes, but rarely the case. And the same would go for hospice too. I'd even hear folks, they're not ready for hospice when
Mm.
they're saying loud and clear, like, I'm done with these treatments. I don't want to come back to the hospital. I just want to
Right.
focus on comfort. And like, well, but they're not dying, they can still talk. It's like, well, that's also
Yeah.
not mandated by hospice. And so and the thing was, none of it was particularly nefarious or like ill intention. It was ignorant. And
Mhm.
that's really the realization I was making, is that there's all this sort of talk about docs having these ulterior motives. They really don't. I think
Right.
most truly want to do the right thing. They're just not trained in communication skills or hospice and palliative medicine. And in the hospital, I was, giving lectures every couple of months, busing this myths to doctors, explaining the difference. And yet the next day I'd be walking down the hall and I hear, oh, I don't know if they're ready for palliative care yet. And it was like I was beating my head against the wall. Alongside this, I was also noticing every now and then a consult would come in and it was like super early, relatively speaking. Like, this person had a pretty new diagnosis and they're reaching out to palliative care. And I said, oh, that's nice. Like, what prompted
Right.
you to reach out to me? And they said, well, the daughter asked for the consult. I was like, Oh, so that's the
Right.
key. If the family asks for it, all the gatekeeping all magically disappears, or at least it
Right.
felt like magic to me. So I thought, well, how can I speak directly to the public about these things and empower more people to ask for that palliative care consult, demand that palliative care consult? And obviously, the best way to speak to the public at scale is with social media, and that's really
Right.
where it all started.
Well, I love, and for any of you who haven't found him anywhere, How to Train Your Doctor, I think that's where you are everywhere. I mean, that's your handle everywhere, right?
Hmm.
How to Train
Hmm.
Your Doctor. Okay.
Yeah.
What I love is that you do like a combination of just front facing, like just here's the deal. And then sometimes you do a little role play back and forth. So you're having a little bit of fun with it, which is hard to do with something like hospice, but I think you do a great
Yeah.
job. And, I love that you mentioned the doctors, like for the most part, they're not trying to, stir the pot or be a problem or whatever. They're just not, they had one rotation probably during their
Yeah.
time, and
Yeah.
maybe they see a pamphlet or maybe they hear a talk on it. I know that when my grandfather was in his 90s, he had, he fell, he was in ICU. Things were not looking good. And because I had already been taking care of my mom for a long time, my family had me come in so I could be like the whisperer, like, what are they saying to
Yeah.
me? Because I don't understand the words. And that's
Yeah.
another thing that happens too, is I think the doctors sometimes say things and people hear what they want to hear because they're not, like, the doctors aren't communicating in a way that families can really wrap their head around. So, like, my family agreed for my grandfather to go on hospice, but still they were just like, "Oh, yeah, but this is just until he perks back up again," and it was like, no, that's not what was they were talking about. And so I know that, like, the communication piece, I guess, is my point, is so difficult. And what I think is very helpful is to have, whether it's a palliative consult or somebody coming in, especially when you're in a hospital setting and there's, like, you're trying to make this decision like right then. Like, we had more time, obviously. Case managers, social workers, people like that also can help. But to have someone that's really going to do some sort of translation for you, like, okay, this is what
Yeah.
they're saying.
Yeah.
And doctors too, one of the things that, like, I had to realize about my mom, like my mom's main doctor, is his job was to fix it. So once there was nothing left to, like, help, like, he couldn't give her anything else to fix it. Like, he didn't know how to care for her.
Yep.
He didn't know what to do. He was like, I don't know what to tell you. I mean, you got everything I got. I don't know. Like, what?
Yeah. Yeah.
And then he did, he explained why some things wouldn't work and all. I mean, it's not like he wasn't, but he was like, I've looked into all this. None of this is going to help you. This is what it is. And then my mom was still stuck with a ton of pain, very weak, all of these things. And so I think that's another thing too, where when you're focused on comfort care, you have that palliative piece, they're going to come in and say, okay, what can we do to make you more comfortable? Full stop, period. Like, let's look at that.
Yep.
And so the first thing they did for my mom was get her a better bed, better mattress. And she was like, threw them in. This is great. All I needed
Yeah.
was a better mattress.
Yeah. Yeah.
um,
And it really
Go
just
ahead.
gets back to just there's such a gap in medical training. There's really very, very little communication skills training, especially complex
Yeah.
decision making support that focuses on values and priorities when we get to a point in someone's illness where there is no fix, there is no cure. And how do we navigate that for the individual? Because what makes sense for one person may not make sense for the next person when we're dealing with something that you're gonna die from this thing either way. But how do you
Mhm.
how do you want this to play out? Like, how do you want your time to look? And at least shape that in some way that feels the best fit for you in the things that we can control. And those are skills that map across so many aspects of healthcare, all aspects of healthcare. But the training to have those conversations was exclusive to palliative medicine. It really felt like it filled in this missing piece of my medical training that should have been there all along. Where the name How to Train Your Doctor comes from. It's how to give you a few tips and tricks to kind of fill that gap and kind of help your doctor help you. Which I acknowledge, when you're a caregiver and exhausted by everything, it can feel like you're getting more work put on you. And it's not gonna be for everyone. I get sort of the resentment that can come from that expectation, but it's more of just saying, like, here's the healthcare system. For all the things we disagree about in this country, one thing we can agree on is the healthcare system is just totally broken and doesn't work for
Right.
anyone other than the insurance companies. And this is more just like acknowledging that and saying, yeah, everything sucks, but here are some things that you can do to try to make it a little bit more easy to navigate.
So we've talked a lot about like myths of hospice and palliative care. We've gone through
Mm.
that a little bit. We've talked about your work on social media, which really helps educate people. I hope everybody will go find you. You also do a little bit of coaching, which is like I
Yeah,
mentioned at the beginning. I
yeah,
was w- like mainlining your content to try to understand whether or not I should get palliative care consult for my mom because from the time my mom moved into the nursing home, after about a month, the main doctor there was like, are you sure you don't want to call in hospice? Are you sure you don't want to call in palliative care? And I was like, no, she thinks she's going home. She's not, but that's where she like her mindset is she's gonna walk out of here at some point. So like we're just not there. Like, you know, and so for a year, he had been saying that. And so, like, I was starting to, she was deteriorating even more. I was starting to see that. So, like, I was like really trying to, and Google did not help. Every article I read was like, so that doesn't clear it up for me. What's the difference between hospice and palliative care? Like, I could not figure it
yeah.
out. And so I finally started just watching. I watched so many of your videos. And then finally I was like, I just wonder if I can just talk to him. Can I just get on the phone with him I think if I just said, this is my situation, yes or no, what do you do? And so I looked at your bio, I found you, I was like, oh, he does coaching. And so that is something that you offer people. Can you talk a little bit about more like how you, in what scenarios people usually reach out to you, how you work with people, and what is the like most often way that what do people reach out for you the most for?
Yeah,
I don't
yeah.
know. I'm a former English teacher and that sentence was just horrible, but you know what I meant. Go with it.
Yes, yes. So I do want to preface all this by saying that 99% of my content is giving folks skills, tips to get better care through their traditional channels. I'll share different resources and ways to find palliative care in your area, how to vet hospices in your area. So for folks who are looking to get that their typical care through typical channels like health insurance, I talk about that stuff all the time. However, every now and then, folks like you would reach out and say, "Well, hey, I don't have palliative care in my area. What am I supposed to do?" Or they'd say, "Hey, I actually want to talk to you specifically. Can I do that?" And so the caregiver coaching that I offer is more to kind of fill that gap for folks who can't find support through the traditional channels. Just having, I wanted to be able to offer something
Mhm.
to folks in that situation. The caregiver coaching services is meant to be more of a one-on-one conversation with someone who is caring for someone with a serious illness like cancer, dementia, heart failure, what have you, to provide a little bit more of a sounding board for the things on your mind, questions on your mind about how to navigate a tricky choice with no clear medical right or wrong answer. And I'm going to walk you through the frameworks that I use to talk to families in a values-centered, priority-centered way. The things that I will get called for may be things like, when would hospice make sense in this situation? Like, what questions should I be like thinking about to help guide me if it's time to talk to hospice or not? Sometimes we'll get calls where someone's already chosen hospice and they just want a clear sense about what to expect, what questions to
Right.
ask of their hospice, how to prepare the other parent for the death of their spouse, or just general sense of, someone's kind of mid stage of a progressive illness and they're kind of wondering what to expect, what changes come with that, what typical medical decisions will pop up that they should be preparing for. So that way
Mhm.
they can navigate those situations as adeptly as possible with that time to prepare it and plan in advance. So they're not faced with what I would call a fake crisis. The medical team see these things coming, they don't necessarily convey them to you, or they don't know if you want to know about those things. And now we're
Mhm.
in the moment, need to make decisions that you didn't have a chance to prepare for. Trying to get ahead of that for folks.
Yes, and to be clear, your videos on TikTok gave me all the information I needed. However, I, like most people, think my situation is different from everyone else's situation. And I was like, but what about?
Yeah.
And so I
Yeah.
remember when I was talking to you, you were like, sounds like you already know the answer to your question. So let's talk about it. And so that was really, and you just mentioned that as well. Like you're listening to people, you're meeting them where they are, and you're kind of walking them through sometimes what they already know. But sometimes we need someone to tell us what we already know. That's something that my mother-in-law taught me a long time ago, is like, sometimes you know the answer, but you just need somebody to remind you that of what you already know. And I really found that extremely helpful. So yes, doing some great work out there. It is a honor and privilege to have you on here today on the From Guilt to Good podcast. I thank you so much for being here. Is there anything else you want to tell our audience before we wrap up? Where can they? I've already said it 27 times, but just in case, is there? What do you want? Where do you want them to find you?
Yeah, thank you for the kind words and the vote of confidence for the work I'm doing out there. And as you mentioned, I'm How to Train Your Doctor everywhere. If you want a good jump off point, just howtotrainyourdoctor.com is my main landing page. On the front page there, you can sign up for my email list, which will connect you to the weekly newsletter. And if you're someone like me that's sort of in and out of actually scrolling social media and you want to make sure that you don't miss a video, the newsletter is really just the weekly recap of the videos I've made for that week, with maybe an extra thought or two about kind of the thoughts behind that video or expansion on that thought. So that way you never need to worry about frantically scrolling Facebook, TikTok, Instagram. You can be sure that you're
Which
caught
we're
up.
all doing while we're sitting in the ER or the doctor's office. If there's good Wi-Fi,
Exactly.
we're already there. But thank you, Matthew. It was like I said, it was a pleasure having you today. And thank you, everyone, for joining me on the From Guilt to Good podcast. To access additional caregiver resources, support our show, and connect with us on social media, check out the show notes. We're also going to have all of the ways that you can get in touch with How to Train Your Doctor there as well. We are changing the conversation around caregiving one episode at a time. Remember, you can be a good caregiver and still have a life outside of caring for your parents.